And we usually celebrate that in the month of February. And this picture of mine is this February. I'm giving a talk to one of the group of ladies. So see, I'm all red, and they had put some red balloons over that. So next is, today is 10th of September, and as you know that World Heart Day is celebrated all over the world in September. Just because heart disease is #1 killer, and people thought that we must have some tools to deal with it. So by now, I think if not all, some people have some idea about risk factors and how to tackle them. But there's one big segment of society, that is the women that have been, is okay. So, so women have been ignored because of two reasons. There were certain myths. #1, that heart disease occurs in women only after menopause. And younger women, if had symptoms like that, was dismissed as a case of broken and a bereaved heart. So now people have learned that if not all, in most cases, this bereaved heart was a diseased heart to begin with. And the second myth was, please, ye sure hai bahut. And the second myth was that breast cancer is #1 killer in women. That is not true anymore. And look at this, I put it in red. Unfortunately, the simple fact of being a woman increases the risk of heart disease and stroke. So it claims that lives of 1 in 3, that is 1/3 of all mothers, sisters, and friends will be gone. So it continues to be a big problem for women. So that is why in year 2004, American Heart Association noticed that every year 500,000 women were dying of ischemic heart. And the tragedy was that both the treating physician as well as the patients were unaware of that. So mainly the reasons were gender bias, poverty, inequity, and that led to this problem. So they thought that they needed an appropriate tool to deal with this menace. So they came up with this Go Red for Women, which is a passionate, emotional, and social initiative designed to empower women to take care of their own heart and makes them aware of their personal risks of developing the heart and gives them the tool they need to lead a healthy life. So Go Red inspires them to make lifestyle changes, and the more a woman knows about her heart, the better chances she has of beating it. Now, Go Red for Women is a comprehensive platform designed to create awareness, and it has a dual connotation. Red is a sign of alert or khatra. This is the translation. And number 2, this Go Red, Go of G stands for get your numbers, which means your weight, your blood pressure, your cholesterol, your sugar, etc. O is own your lifestyle, and R is the risk factor assessment. E is educate yourself or people around you, and D is the most important, that is you disseminate this information and don't be quiet over any symptom that you face. You must immediately consult your physician. Now, it's very important to understand, as somebody was telling me at lunchtime, that you always talk of pathophysiology. I'm Dr. Hafiz Khan's student. He was told that every problem starts with pathophysiology of the disease. And as we, the ladies, look externally different from men, similarly, there are inner changes that are different from men, inner structures. Like coronary arteries are narrow, and their diameter is smaller. And number 2, the biggest difference is that in men, the atheroma protrudes into the lumen of the vessel, and that is why when you do an angiography, you can pick up the obstruction. But in women, look at that. If I hope I can, this black thing, there is ulceration along the wall. And even if you do an angiography, the result would be non-obstructive coronary artery disease. So the woman is given a free sheet only weeks or months later to learn that so-and-so went off to sleep and never woke up. See, the problem here is microvascular. And I have made the human body, this is the female, start from, since I teach students, and I always like to follow a system. You start from your head. Now, what do these women complain of? Headaches, lack of concentration, and some cases of frank depression. In Rawalpindi General Hospital, I used to receive phone call from professor of psychiatry, madam, एक patient है not responding to antidepressant, we are now planning to give shock therapy, वो बस थोड़ा सा हाथ देख ले. Oh God, this is not depression. Look at, नहीं, ECG normal है, but when I would do echo, ejection fraction is 40, 45, sometimes 30, 35. So I would take care of that. I would detect that at least 30 to 40 out of 100 such patients refer to me from psychiatry department. Then you have your eyes, especially if a patient happens to be hypertensive as well, sudden loss of vision, dimness of vision, and they go to ophthalmologist. Again, they would say, आँख तो बिल्कुल ठीक है, ज़रा इसका heart check कर ले. Then you know, this is your lungs. Shortness of breath is a very important symptom, and these women keep going to pulmonologist. And the worst is they give beta agonist, and they always call, जी pump दिया था और उससे बड़ा फर्क पड़ा. So temporarily the symptoms improve, the disadvantage, the underlying disease goes on worsening. And another one, this is your gastric. जी खाना हजम नहीं होता, difficulty है. And they keep consulting different gastroenterologists, and endoscopy reports comes almost normal, mild gastritis, and they give them antacid and H2 receptor blocker. Again, temporary relief, but underlying disease goes on worsening. Then kidney problem and pain in legs is a very important symptom, and they keep having these painkillers just to damage their kidneys and the liver. So it's very important to understand these symptoms, and we from the platform of Go Red are trying to create awareness during these meetings. But I'm very sorry to say, like elsewhere in the world, we say that women are underdiagnosed, undertreated, under-researched, and you have seen that the hall was full. At the moment it was handed over to a woman, it's almost vacant. So with that, I would now call upon the first speaker who would elaborate upon my last comment, undertreated. That is Professor Amber Ashraf from Peshawar, and she's a very active Go Red member. And please, Amber, come on.